Weaves, wigs, braids, we love to wear them. Or are they wearing out those delicate edges and causing other hair loss conditions? Welcome to Naturally Brown Woman Workshop. I'm Tammy Williams. This workspace is dedicated to helping you rescue and maintain those precious hair edges. Plus, we'll discuss other medical hair loss conditions that are secretly plaguing women and taking a real emotional toll. To help us on this journey today, we start with Dr. Samaya Talaferro, founder of Atlanta Dermatology and Aesthetics. Pull out your pad, pen, or device, and let's workshop it. Hello, Dr. Talaferro. Thank you so much for being here on Naturally Brown Woman.
My pleasure.
And congratulations on your practice.
Thank you.
8 years?
8 years.
8 years you've owned your own business?
Moving toward 8 years.
Moving toward 8 years. Oh, that's awesome. I know you've seen a lot in your office. And one of the things we want to talk about today is hair loss. You know, we're finding that it is unfortunately common, too common amongst African-American or brown-skinned women, and we don't do a lot of talking about it, because of, I guess, the shame and the embarrassment that comes along with it. Yeah. So first, I want to talk about some of the obvious things. Styling ourselves bald is what I want to call it. Styling. Yeah. I'm the first one. I love braids, right? But there's got to be a way that we can wear our beautiful weaves, but not have to sacrifice our hair.
So the hair styling that tends to cause some damage to the hair, we refer to that as traction alopecia.
Okay.
And that is very common among African American women, much more so than other populations because of some of the styling practices that we love. Ponytails, braids, weaves can cause tension on the sides of the hair, and it really can, over time, pull the hair out. And I see that as early as really young ages,
Like
grade school ages.
Grade school?
And so sometimes if I'm treating an adult patient, female typically, that has traction alopecia and they have their children in the room, I'll counsel them on preventative techniques for helping to reduce that in the children.
Yeah.
So like the old school practice of taking the barrettes out of the hair at night for sleep has historically minimized traction alopecia.
Okay.
So I think we realized that years and years and years ago and started to do things like that to minimize it. But that is very common, and often patients are genetically predisposed to develop that type. So if I see it in the mother, then I try to educate to prevent it occurring as early in the children.
With the different styles, let's start with tight braiding. I heard the saying say, it is not right if it ain't tight. I have a friend who actually does pain-free braiding, and I love. You don't have to take a pill with it.
It doesn't have to be painful.
It doesn't have to be painful. But when the hair is being pulled, right? What exactly is going on?
The start of traction alopecia occurs down in this layer. And most hair conditions start near where the bulb of the hair follicle resides. So with skin, we have the epidermis, which is the top layer of skin cells. The dermis is the next layer. And the bulb of the hair follicle, the sort of powerhouse of the hair follicle, if you will, resides in the dermis. And so what ends up happening is stress from pulling causes inflammation down in here. And that later results in scar tissue that can start to develop in this area. And it sort of loosens the follicle, or it takes away some of its nourishment. And so the follicles can diminish and then just basically die and fall out and not regrow if it's pulled out over time. And so it's the force of and tension on the hair continuously that's damaging this area. And so the hair no longer grows as strong and healthy.
Yeah. So, and that's probably why we see some of our African American sisters with like the hair starts to recede after a while. It just kind of starts to recede because this has been just pulled tight for too long.
Yes. Now, it could be receding from traction alopecia, but it also could be receding from a genetic predisposition for thinning in that area with age.
Wearing weaves, how much does like the glue, having glue?
I'm glad you
around
brought
your
that
edges,
up because a lot of people now are much more aware that the glue can be damaging. So we didn't know probably how damaging when the use was very popular in the beginning. But now we know that there are other means of allowing the hair to adhere to our own hair if we're wearing a weave or wigs, and to not cause as much from glue, because glue, when you have to remove the glue, there's no way to avoid pulling. There's just no way to avoid pulling that hair and causing unnecessary tension on the hair. And if that occurs over and over and over again repeatedly, then this hair is not going to keep growing. That hair won't continue to grow.
Yeah. About how often you think that that a person should wear a weave or get braids?
That's a good question. I do encourage my patients to take holidays, a weave holiday, or
maybe we should declare that a national holiday, a weave holiday.
Which basically means it's a break.
Yeah.
So that can mean the range can vary from patient to patient. So if you have a patient that's prone to traction alopecia, they have a history of it, they have a family history of it, then that person may need to definitely avoid really tight and high tension braids. Even the smaller braids can cause a little bit more tension on their hair. And for a patient like that, I may say only keep your braids in for a few weeks and remove it, and then give your hair a break. Don't go back to the braiding style immediately. And someone who does not have as much of that predisposition, they can get away with 6 to 8 weeks or so. So it just sort of depends on the patient. But typically I say 6 weeks, or less. And sometimes that's feasible for patients. Sometimes it's not.
Because sometimes it becomes a cycle of you start losing your hair, then you want to
continue to do
to cover it
something.
up
That's
because
exactly
you feel
right.
really bad or shame or
exactly
like
right.
you said, the stigmatisms that come along with wearing
Well,
it.
we all want our hair to look as full as possible,
yes.
as thick as possible, as healthy as possible. And that's a universal desire all over the world.
We don't want this beauty to cost us.
Right, but at what cost? I heard you ask early. And so, yes, we need to make sure that we're doing what's best for ourselves. Maybe not make sure that we're keeping them in too long. If it's braids, make sure that they're not as tight. And I tell my patients, I don't tend to get my hair bone straight because I like big hair. And I'm glad I like big hair because then I don't have to really over process it and overheat it. And over time, I think that that's going to help. Now, has that always been as popular over the years? Not necessarily, but I think it has saved my hair.
We see a lot of things on the internet about, there's lawsuits regarding chemicals, perms, relaxers, and hair. Any thoughts on how chemicals affect the scalp?
That's a great question. I think that the jury's still out on relaxers, for example. But I know that we have data to show that chemicals in various forms, it could be chemicals in color, strong colors that are permanent. It could be chemicals from relaxers can have an impact because often the chemical is designed to really only affect the hair on top. But what eventually happens is the skin is porous and the hair is too. So some of those chemicals will have an impact lower down in the dermis and a little deeper in that hair follicle, whereas it was never intended to even see that area.
Right.
And so long term, that can cause a cumulative effect of damage.
Yeah. So it'll be interesting to see what really pans out regarding relaxers, and because many of our, African American women love those relaxers.
Exactly.
Everybody hasn't transitioned to natural. I love natural. I had a relaxer for years.
Yes.
And then transition has been one of the most wonderful thing for me. But there's still some more information that needs to be gathered.
And in dermatology, I think of this issue in the same way as sunscreen. Mm-hmm. So years ago, people would put on iodine, betadine, I should say. They would lay out
yes.
and tan, because we did not know all that we know now about mm-hmm. the damage yeah. of cumulative sun exposure. And now we know a whole lot more, so we can practice differently mm-hmm. And behave differently. Mm-hmm. And so we're accumulating more data about relaxers. It's very difficult to tell a patient that you should not use relaxers at all, because the data is not that strong.
Mm. That's interesting.
Yeah.
We are continuing our conversation on Naturally Brown Women with Dr. Talaferro. And joining us, we have Kimberly Knox, who is a psychotherapist. She has a practice here in the Atlanta, Georgia area. That's ARC, this initial is ARC, which stands for Active Resilience Counseling and Coaching. And we also have Kendra Farmer, who is a master cosmetologist and braider and a wig specialist who has a very special story that she's going to share with us today. And we're all talking about hair loss. And one thing I didn't realize, we were talking about alopecia earlier on, that is a common term. It's really a generic term that's interchangeable with just hair loss, period.
Exactly. Mm-hmm. So I often tell patients when they come in, they will ask me, do I have alopecia? And I'll tell them that alopecia is a catch-all term for hair loss. It's a medical term. It's medical terminology for hair loss. So my job is to help you figure out what type of hair loss you have.
Yeah.
So for example, there are different types of alopecia, different types of hair loss. Scarring alopecia, mm-hmm, mm-hmm. genetic alopecia, which we call pattern alopecia, and sometimes we refer to it as androgenetic alopecia. And we have alopecia areata. We have a certain type of alopecia called frontofibrosis, mm-hmm. Alopecia, and so there are different subtypes of alopecia.
If you ever find like a small spot in your hair, and mm-hmm. it's like, what is this? And sometimes it's due to stress.
That's true. And I tell patients you can have hair loss from emotional stress or physiologic stress or physical stress. So physical stress would be the kind of stress that's real tension on the hair from mm-hmm. some external factor, and that creates generally traction alopecia. Yeah. But you can sometimes have emotional stress that leads to certain types of alopecia, not just one type. Different types can emerge from that. And that can be from a move, a breakup, mm-hmm. a death in your family, mm-hmm. some stressful life event. Yes. And sometimes patients can be under stress for such long durations that they don't even realize they're under stress. Mm-hmm. And when people came in during the pandemic, I would often ask them, do they feel as though they've been under stress? And there would be some patients who would say no. And I would question them. Mm-hmm. I would say, well, I think a lot of us are living under stress and we may not even really realize it.
Yeah.
And then, of course, there's physiologic stress, which mm-hmm. could literally be from something going on, a change in the body. Mm-hmm. So it could be a new medication, it could be early thyroid disease or early onset diabetes, or early autoimmune disease, which can cause mm-hmm. enough inflammation and enough of a change in the body to cause a physiologic type of stressful induced hair loss. Yeah. And we often refer to that as telogen effluvium. Mm. So that one doesn't have the word alopecia.
Yeah. And it's so many different types and ways that women could lose their hair. But either way it goes, it can be a very stressful and traumatic experience when you realize one day your hair is thinning. There's something different that's going on that I hadn't experienced before. Kimberly, if you could talk a little bit about the trauma, mm-hmm. and we're using the word trauma because it's not like a little oops.
Yes, it is.
Trauma. Go ahead. Tell us a little bit about that.
Yeah, so a lot of times people have like this one dimension or this one definition of trauma. Trauma in its true definition is an emotional response to an event or an experience, a painful one at that. So losing your hair absolutely falls in that category of a traumatic experience. Especially, it would be remiss of me not to mention in the Black community, as a Black woman, to lose your hair, the attachment or the bond that we have with our hair, and when we lose it, especially due to something that's out of our control, it absolutely causes trauma.
Yeah.
And there are different types of conditions that fall within that trauma umbrella. So when it happens unexpectedly and you have that emotional response to it, it's called acute stress disorder. And that falls between something happening immediately up into 2 months. When it goes over that 2-month mark, it falls into the PTSD, what most people know about trauma. Post-traumatic stress disorder.
Wow. So it actually can become that situation as far as PTSD.
Yes, it depends on the severity of the experience or the event, and it depends on how somebody reacts to it.
Yeah.
When it impairs your functioning, that's when we have a lot of concern.
Yeah. And you know what, with the traction alopecia we were talking about earlier, and what women would sometimes do when they start to lose hair, put the wig back on, or put the weave back on, or to cover it up, right? And then the hair never gets a chance to really grow. But talk about that cycle creation and what emotionally a person could be going through. Would you talk a little bit about trauma here?
Okay, so the emotional part of it is, like I said, that attachment, that bond we have to our hair is a relationship. So when you're going through losing your hair and putting your hairpiece on, it kind of boils down to your identity also. Like, who am I? You're a different person because this huge traumatic event has happened. You're trying to figure out who this emerging person is. So going back and forth, you're vacillating between the old you, the new forming you, and you're trying to figure all that out.
Yeah.
And that's a process.
The day that your life took a slight turn.
So in 2020, I was diagnosed with breast cancer. And my second chemotherapy treatment, all of my hair fell out. It was coming out in clumps, so we cut it off. So then I'm thinking, like, what to do now? I don't have any hair, I'm bald. So I went to wigs, glueless wigs. I needed something. With the chemotherapy, you're forced into menopause, so I needed something that I could take off every day. So that's where I started wearing wigs.
Let me ask you this right here. When your hair started coming out, what was that process for you? Were you combing your hair and you looked down in your brush? Explain what happened to you that day and what went through your mind.
Yes, I was combing it and just coming out. And I'm like, oh my God, this, I'm like, what to do? Yeah.
Could you identify what Kim was saying regarding, did you deal with the whole identity crisis?
Yes.
Like, who am I now?
Right. I never would have expected to be just bald. I mean, it was completely bald. Well, now I'm in remission and my hair has grown back. It has grown back. So everything's better now.
What would you share with somebody who's kind of going through this whole process?
Don't let the baldness define who you are.
Yeah. How did you get over that hump to help with your self-esteem?
I did a photo shoot, bald.
Oh, okay. Okay.
I did one bald. And I don't know, just was accepting it at first.
Yeah.
But I would never go out in public like that. I don't know.
Okay. You haven't hit that stage yet.
No, I didn't never hit that stage, but yeah.
Yeah. Any thoughts for Kimberly, in her process?
Yes, she hit on two of the things that we posit when it comes to the healing of any type of traumatic experience. One is you want to establish that safety and stability first. And we have different ways to do that. Breathing exercises, just a lot of different tools in that area. And then the second stage is remembering, grieving, and mourning that process, which just sounds like you most definitely did. And then when you get to the last stage of reconnecting with the world, reconnecting with yourself after that event, you hit on the two big things. One is acceptance. Once you begin to accept what happened, and the other thing is not allowing it to define you. This is something that happened to you, it is not you. And you do that through acceptance. And then you begin to get to a place where you can fully heal, and then fully get to the point where you can have new meaning. You're at a new place with, I have a new relationship with, like you said earlier, my crown. So that's like a brief, condensed three-stage model of healing trauma.
Wow, you mentioned making sure you grieve through it, because there is a loss there.
Yes.
And when you lose something, you will grieve, no matter, grieving over something that was lost. But coming back to the acceptance and finding the new you, it could be an exciting journey. Sometimes maybe a scary one. Yeah. And I love when you said it happened to you, but it's not you.
But it's not you.
Yes.
It's not you.
It doesn't define you. And the fact that you had a photo shoot tells us that you knew and could see that there was beauty still without the hair.
And celebrate it.
As there truly there is.
Well, I want to commend you on your bravery, first of all. And thank you for sharing your story and your transition that you went through. I think the big question today as we talk about hair loss is, can the hair grow back? If so, what should they do?
So my first means of assessing prognosis of whether or not the hair will grow back is to ask how long the hair has been gone. That's one of the first questions, because hair loss that's been gone for many, many years would be very difficult to grow back. Because what happens is sometimes you can just have a diminishing of the hair follicle. So this brown follicle might get smaller and smaller and smaller to the point where you might not even see much at the tip there, but the bulb of the hair follicle still has some activity. But long-standing hair loss, often the entire unit has fully involuted, is basically gone away.
Okay.
And so we call this sort of the power unit, the bulb of the hair follicle.
Yes.
And that's where you have regenerative cells that can sometimes help stimulate new hair growth or new healthy hair growth. And I always try to catch a patient at a stage where there's still some activity there. In many cases, I'll tell patients, my goal is to get 30 to 50% recovery.
Okay.
Because in some cases, I know right away, based on certain factors and time and the type of hair loss sometimes, that the chance of 100% growth there is very, very minimal.
Okay.
So it depends.
So need to get to a specialist dermatologist right away. As soon as you see anything, make your way to see a dermatologist.
And what helps us in early stage hair loss and long-term hair loss in some cases is to perform a scalp biopsy. And we are trained to know how many follicles should be within that unit of sample of skin. And that number can be different for an African American patient, an Asian patient, a Caucasian patient, but we have some sense of what that number should look like in an average patient of all ethnicities. And you can literally count it, the units. You can see what's happening on a microscopic level and tell the chances of regrowth as well. So that's certainly another tool that we use.
Yes. Okay. Excellent. So we got to practice good hair practices, and
don't wait too long.
And don't wait too long
for assessment, because
yes, the sooner the better.
That's right.
Okay. So have a couple of true and false questions here. We like to break stereotypes and myths and bring the truth to light. So first question, you all can jump in. All right.
Okay.
True or false? Hair loss is less common in African American women compared to women of other racial backgrounds.
Well, 2/3 of women overall will experience hair loss. Those statistics have been there for many years, and that's across the board, all ethnicities, generally, the broad population. I think that there's certainly specific types of hair loss that are much more common in African Americans.
Okay. Which is true or false? African American women are more likely to experience hair breakage than hair loss.
My impression is yes. What would you say?
True.
Yes.
Because our hair, the nature of our hair is coily, and that in and of itself makes it more likely to break, a greater propensity for breakage.
Yeah. It says especially due to practices like tight braids, which we've been talking about, weaves, and the use of heat styling tools, which can weaken the hair shaft. Yeah. True or false? Wearing a silk or satin scarf or bonnet at night can help reduce hair loss in African American women.
I think it's true.
True. We have
all been taught that.
They come in so many colors. Sometimes I wonder about all those different colors and if that dye has anything. Well, it's a whole other study. But
But yes.
Yes. Guys, thank you so much for joining us on Naturally Brown Woman, but we have more to come. We're going to say goodbye to Kimberly and Dr. Talaferro. Kendra is going to stick around because we're going over to the chair.
Okay.
She's going to demonstrate how to put on a wig, the proper way. She's going to do some installation. And you heard her earlier, she talked about those glueless wigs. So we're going to talk about that. Welcome back to Naturally Brown Woman, where we are actually in the Naturally Brown Woman salon with Kendra and Denise, our hair model. What inspired you to create your beautiful wigs? And the hair feels so good and so soft.
Just knowing what I went through and seeing other people go through the same thing, just to get that self-confidence while going through the breast cancer.
How important is it that the hair is braided in a certain way?
It should never be tight, and you should always braid it back to the back so it'll have a flat, it'll lay flat.
I notice you have the cap on. Is there any particular type of cap you should get?
I like to use more of a HD stocking cap, more flesh tone.
Okay. And will this help prevent breakage or?
Yes, it helps maintain the integrity and health of her natural hair. These wigs are beginner friendly, so really she just adjust the strap to the back and place it on.
That seems real simple. I think I can handle that. Oh, it's lovely. And it's that easy. And I know even the part here looks pretty natural, even to her skin tone.
Yes.
So the big test, is this Six Flags over Georgia roller coaster ride?
No.
Okay, no. Okay.
Not Six Flags, no.
Okay.
But I do have another solution if you want to go to like Six Flags or something. It's a temporary product.
Tell me about that.
So it's water soluble, but it lasts a day.
Okay.
So you put it on and take it off with water at the end of the day.
Okay. So you would, in fact, if you could just kind of show us here, you would actually slide this off here and just put it around. It's like a water-based glue type of solution.
Yes.
And they do exist, which is better than the other types of glues. Getting something that's water-based and that will go around the scalp here. Any do's or don'ts as it relates to that?
Just make sure you don't put it on that hairline. Always put it on the skin, never on the hairline.
Okay. And then slide the wig on that, and that should make it last a day for the day. So you can go to Six Flags and do a roller coaster, flip upside down, and everything is going to be okay. Yeah. So Denise, how does it feel on you? How does it?
It's very comfortable. I've never personally worn a unit before, but it's comfortable. I like it.
Does it feel light
It
or
feels
tight? Does it
light.
feel tight?
Not at all.
Not at all? Okay, that's great. That's great. And you have a couple of other pieces. In fact, there is a nice braided piece over there that's absolutely gorgeous with beads on it. I really like that one. And then there's another one that we have sitting here on the set. So really, really love those. How do you take care of it? How do you help it keep the shape? And
Well, I always tell the clients to shampoo, condition just like you would your regular hair. And for the curly part, I would use like a curling gel and let it sit, and it'll bring back the curl.
Okay, awesome. And then as far as like putting it overnight, you just getting a regular mannequin head and things like that. Yeah, yeah, very beautiful, very beautiful. Kendra, thank you so much for being a part of Naturally Brown Women, and thank you so much for sharing your story. It's a powerful testimony. We believe that together we can face the challenges of hair loss and emerge stronger, more confident, and ready to embrace our authentic selves. Until next time, take care. Remember that you are beautiful just the way you are. Most importantly, be kind to yourself and be kind to others. That's what we like to say. Be kind to others.